to the next module, which is an overview of school-based Medicaid for personal care services. Who would need this information would be special education directors, teachers, school nurses, and your Medicaid billing staff. The supporting documents will be a new school-based PCS nursing assessment, a new school-based PCS allocation tool, examples or a sample of a PCS plan which could be used as a district's health care plan if it meets their district's requirements for a health care plan, a new QIDP assessment, which is still in development, and we will be discussing what a QIDP is, and a list of community PCS nurses that districts can choose to contract with to provide nursing services if they do not have a district nurse. So with that being said, we're going to continue. This module is designed to provide an overview of school-based Medicaid personal care services. What is a PCS service? Who qualifies to deliver personal care services, a discussion about a PCS plan or healthcare plan, what is a QIDP and what do they do, and what needs to be on an IEP. Each module is set up with the same format to be used by districts to train their staff on school-based Medicaid services. Each module contains a PowerPoint presentation, speaker notes, and supporting documents. The previous slide identified who would benefit from this information. It is important that the IEP team assesses the student, prioritizes the student's needs, and develops the IEP. Then, and only then, should the team start talking Medicaid. If the student becomes ineligible for Medicaid any time during the IEP year, all services identified on the IEP will need to be provided to the student, whether the student is eligible for Medicaid or not. Personal care services, when we're talking about them, include basic personal care and grooming, assistance with exercise, walking and transferring, assistance with medications, training programs to help people with developmental disabilities achieve more independence, and we need to note that PCS is not skilled nursing services. This list identifies all of the different areas in which personal care services could be provided to a student. I'm not going to read each and every one of these, but again, each category gives you some specific information about what that area covers. So for example, toileting use refers to how well the student can manage using the toilet, bedpan, or a urinal. It includes adjusting the clothing, getting off and on the toilet, cleaning oneself, changing pads, and managing a colostomy or catheter. Again, so you can see the list here goes through more detail about what each of these areas would address. Please note that academics is not part of this list. So who qualifies for PCS? First of all, students that are eligible for Medicaid, and that the student is on an IEP based on having a qualifying educational disability. The results of a PCS assessment that has been developed and approved by the Department of Health and Welfare would be used to find that the student requires PCS due to a medical condition that impairs the physical or functional abilities of the student. So you can see in this particular slide there are three criteria for a student to be able to receive PCS as a Medicaid billable service.
First of all, again, the student would have to be eligible for Medicaid. Secondly, the student would need to be on an IEP based on a qualifying educational disability. In our previous discussions or modules for behavior intervention and behavior consultation, we identified that the student would have to have a developmental disability. This is not true for PCS. Again, the student would just have to be on an IEP based on a qualifying educational disability. And then finally, they would then further qualify for PCS services as a Medicaid billable service because of the results of the PCS assessment that the nurse would administer.
Services under PCS still must be considered medically necessary. It must be a medical service that is provided in a professional standard that provides a service that helps that child meet their educational goals and objectives. Remember that prior to identifying a Medicaid reimbursable service on the IEP team needs to be sure that the service is medically necessary to assist the student in accessing the educational environment or educational curriculum. Since Medicaid is a medical model of service delivery, Idaho has determined that a physician or practitioner of the healing arts is responsible to determine medical necessity in order for the service to be provided by the school district as a Medicaid provider and being reimbursed by Idaho Medicaid. A school district or charter school may not seek reimbursement for services provided prior to receiving a signed and dated recommendation or referral from a physician prior to billing school-based Medicaid services. A new PCS assessment tool has been developed and approved by the Department of Health and Welfare Division of Medicaid to assist in assessing the needs of students who potentially may qualify for PCS services. A nurse, either a community or a school nurse, will complete the personal care service assessment, and that assessment score will then translate into how many hours of PCS a student would be able to access in a school setting. This is a copy of the assessment will be posted on the Idaho Training Clearinghouse Learning Community under Medicaid for district's use within the next couple of days, no longer than a week, I would think. The form will look like this. It has identifying information, and then it will start asking questions within the various areas such as grooming and toileting and mobility, transitions, use of adaptive devices. So this form has been approved. Districts would fill it out by a school nurse. It will be a Medicaid billable activity. Now, you can start using this now.
So who administers the PCS assessment and develops that plan of care? A licensed professional nurse as an RN or an LPN. If the district does not have a nurse or LPN on staff, you can contract with a community PCS nurse to provide that service.
A list of those nurses will be provided on the ITC for districts to use. The department will also be doing some training with those community nurses to let them know that if school districts do not have a nurse within their district, that they could be contracting or contacting those community PCS nurses.
You can find this PCS agency list on the Department of Health and Welfare website. Again, you will see the way that you can find this on their website on the speaker notes of this PowerPoint, but it is under medical, then go to the Medicaid tab, and then home care and adult and disabilities PCS providers under the resources. Again, Susie Choles, the RN who is the alternative care coordinator under the Bureau of Long-Term Care, you see her name and number there, and you could contact her directly as well. There are 3 new tools, as we've said already, to help assess and identify the needs of students that qualify for PCS. The Department of Health and Welfare has created a school-based PCS assessment tool that will help districts rate a student in the area of these daily living skills. After the nurse completes the assessment, there's an allocation tool that translates that assessment score into the total number of hours that a student could access PCS services during their school day. The nurse would then write a plan of care that identifies how the needs of the students would be met. This also, again, translates to what the schools have been typically using as the health care plan. It should be noted that after the number of hours are determined on the allocation tool, it does not obligate the district to provide that exact amount of hours. It indicates the maximum amount of hours that the student would be eligible to receive. Oops. The allocation tool is divided, and you're seeing a copy of that. It is an Excel spreadsheet form. This tool has been used in the community for community-based PCS services for many, many years now. And the tool, this is the school-based services assessment, and you can see at the top of the form that this particular form is for ages 6 to 9 years old. There are 3 different age ranges that the tool accommodates, ages 1 to 5, 6 to 9, and 10 plus. And some of the skills are weighted. You can see again on that form that some of the skill areas are weighted more than others, again depending on the age of the student. Younger age students obviously do not have or they would not be expected to have all of their toileting skills as compared to an older student. So an older student, if an older student needs assistance in toileting, the lack of those skills is actually weighted more, which would translate into more hours being available to provide that service to the student.
The Excel spreadsheet will have a different tab along the bottom when you open it up, and whomever is doing the allocation by entering the scores from that PCS assessment needs to make sure that they are clicked into the appropriate age range for the student that they're trying to allocate those scores for.
Again, this would be completed by the RN, whether, again, it was the district RN or somebody you are utilizing from a community PCS agency.
So the health care plan actually is a PCS care plan. The plan of care must include all aspects of medical and non-medical care that the provider needs to perform, including the amount, type, and frequency of the necessary service. Your district may elect to utilize community-based PCS care plan, which you may modify for your own use, or use the care plan that your district has developed or your health care plan that your district has developed. A nurse must complete the PCS care plan. The delivery of the PCS plan may be overseen by a licensed professional nurse or a qualified intellectual disabilities professional, or QIDP. Oversight must include assistance in and developing a written plan of care, review of the treatment given by the personal assistant or the paraprofessional teacher, through the review of the participant's PCS records as maintained by that provider, the school district, and reevaluation of the plan of care as necessary as identified in a DAPA rule. After the nurse completes the PCS assessment, the center green button, student qualifies for PCS. If you go to the left, the nurse completes a healthcare plan and identifies no skill training needed in any of the areas that were identified on the plan of care. You then just provide services to that student based on what that plan of care, and you can build Medicaid for those services that have been identified. However, if we go to the right and the nurse completes a healthcare plan and the team has identified areas that need some skill training, maybe it's around toileting, maybe it's around transfers. It could be around the use of assistive devices. Then a QIDP, or a Qualified Intellectual Disabilities Professional, would complete an assessment, and those skills would be addressed as skill building on the IEP. It would actually have a present level of performance and how the child would start learning to do those skills. The QIDP is a new Medicaid billing options for districts. The QIDP assessment is currently in development and will be available as soon as the Department of Health and Welfare provides us approval for what that document can look like.
To further clarify, again, the difference here is between a health care plan for a student who just needs services provided to them. In other words, the paraprofessional or teacher in the classroom is going to provide for the student's need. They're going to feed the student, whether it was a tube feeding, or they're going to change the student, take the student to the bathroom, and that's what you see on that left-hand side. There's no skill training that's going on. The services are just being provided to the student, and again, based on that initial assessment of those areas of need. On the right-hand side, that student still has services that they're probably being provided to them. So, for example, again, in that same example, the student is tube feeding, but at the same time, the team has determined that there is a priority need to teach the student the toileting, part of the toileting routine. And so in that situation, the healthcare plan not only identifies those services that are being provided to the student, in other words, the tube feeding, but in addition, the team has determined that there's going to be an IEP goal for the student to learn part of that toileting routine. There's like Shannon, that would be related to toileting, and the health plan would not only indicate services that are being provided, but in addition would identify that there is a skill-based training component, and that's when that QIDP would be a part of that process.
So again, districts will be able to bill for delivering a service as well as training on a service, or a combination of both. A qualified intellectual disabilities professional must have at least 1 year's experience working directly with individuals with developmental disabilities and meet the minimal federal requirements for a QIDP. In a school setting, that is a special ed teacher with at least 1 year's experience working with a student with a developmental disabilities. So special ed teachers are seen through the federal educational requirements to be a QIDP. A QIDP's role is to, with students that qualify for PCS, and the IEP team has identified the need for a skill training within one or more of the daily living skills, may receive skill-based training. So through the personal care plan of care that was developed by the nurse, aspects of that plan were identified that needed training in the areas of daily living skill, and an assessment is completed by that QIDP. The goals are identified on the IEP. Those goals are reviewed quarterly or at least every 120 days and reevaluated and changed as necessary, but at least annually. The RN and QIDP, or a combination of both, can provide that supervisory oversight to the deliverer of the service. Records will need to reflect that the student's PCS record or service was reviewed by either the QIDP or the RN on that quarterly basis. So a QIDP plan actually is an IEP. So the assessment is what we're working on with the department to see what part of our current eligibility assessment would work for that QIDP assessment, but the actual QIDP plan actually is the IEP. No need for a separate plan.
So do we need to do present level performance and goals for PCS Medicaid? It's a yes, no, or maybe answer. If yes, if the IEP team deems that the activities of daily living is a priority need for the student, just like any other priority need identified by the team, you would need to write present level performance and a goal for that student. If the team determines that there would be no priority needs in regards to skill-based training, then the PCS service that's being delivered to the student, for example, whether it was changing a diaper or assisting a student during eating, transferring, and so forth, then it is just the PCS service that's being provided to the student, and you would not need to do a present level performance and a goal. So again, it's maybe. It entirely depends on the needs of the student and the priorities of the student and the team determining what would be a priority need and what things are just services that the team and the school are providing to the student in regards to their physical and medical needs.
Okay, we want to clarify that PCS does not only meet the needs of those students with developmental disabilities and qualify for Medicaid. We need to adjust this slide based on some clarification that we received from Medicaid just this week. That's how down to the wire we've been in developing these presentations, is we get interpretation anyhow. So students do not have to only have a developmental disability qualifications. They just have to have a educational disability as identified in IDEA, be on an IEP, and qualify for Medicaid. So if that is the case, PCS assessment is delivered by the nurse, and any additional assessments can be done by the QIDP if skill acquisition is being identified. You must have one of, at least one, an IEP goal related to the plan that says what is going to be taught in the area of daily living. PCS services only, and then it's included on the service page, or both. There is an IEP goal with an objective, and a service is going to be delivered based on a healthcare plan. So again, this slide needs to be corrected based on guidance that we received this week from the Department of Health and Welfare in regard to the student not needing to be qualified for a developmental disability as identified in a DAPA rule.
So who can provide these PCS services? The medically oriented services having to do with the student's physical or functional requirements, such as basic personal care and grooming, assistance with bladder or bowel requirements, and assistance with eating, including feeding, must be identified on the plan of care and may be delegated to an aide in accordance with the DAPA, the rules of the Idaho Board of Nursing. All PCS services must be identified through the assessment, as we've indicated, completed by the RN or LPN, outlined on a plan of care, but they can be delivered by the teacher or paraprofessional with at least quarterly oversight. And again, we would emphasize that PCS services are not skilled nursing services. It's important to remember that services are billed based upon the service being provided, not on the qualifications of who is providing the service. For example, if an RN is taking blood pressure daily for a student to monitor the student's heart, the service would be billed at an LPN rate, since this is not a service that requires the qualifications of an RN to perform. This holds true for every Medicaid service.
So what needs to be on an IEP? Goals and objectives are required if the daily living skills training has been identified as a priority for this student. Goals and objectives can be an example of adaptive skills listed as an IEP goal as daily living instructions, adaptive skill instructions, or personal need instructions. The service page would need to document the need for personal care service, daily living support, adaptive living supports. But remember, whether the child receives Medicaid or not, if it's a priority need, these would be identified as a goal and on the service page whether the student's receiving Medicaid or not. If a district requires a health care plan due to the student's level of care, such as feeding, catheterization, or seizures, then nursing oversight should be documented on the service page as well. An example of this on a service page would be nursing or QIDP oversight, PCS service oversight. Again, whether the student would be receiving Medicaid or not. An IEP goal would only be developed if the team has prioritized one of those areas of daily living skills as being a need for skill-based training. In that case, there would need to be a present level of performance, an annual goal, an evaluation process, and any assisted technology that might be identified with that goal. The service page, again, would reflect the need for daily living skills, nursing oversight if necessary, QIDP, which would be skill oversight, again, delineating in the optional service delivery section who would be performing which of these services if necessary. A new Medicaid IEP form has been created to help districts to identify the school-based Medicaid services and who will be providing that service, whether it be a professional or a paraprofessional, start and end dates, frequency, and duration. Again, this is an optional form that districts can choose to use. If the district chooses to use this form, they will now have the option of using a vetted and approved Department of Health and Welfare and Division of Medicaid form and would no longer be required to try and find appropriate ways to report Medicaid on an IEP service page. This form also has a place for the physician's signature to act as the referral form. This form is currently in draft form until approval through the legislative session during the 2013 legislative session.
It's important to remember that Medicaid is a public health insurance, thus following a medical model of service delivery, so you should not be billing Medicaid prior to having that physician's order in place. The new Medicaid IEP form and Medicaid eligibility form can be used to get the physician's signature. So again, that documentation prior to billing, you would need that current IEP indicating the need for service, your physician's orders, or making that recommendation or referral, and as well as that health plan, which also again is that PCS care plan, which is this requirement for PCS services. In this example, we've shown an IEP service page. Again, we've listed nursing as a service that the team was going to be providing, again, whether the student was Medicaid eligible or not. But in this case, the student does have Medicaid. And nursing in this situation has been identified as being a personal care service supervising RN visit. The daily living skills service, you can see we actually broke up into two Idaho school-based Medicaid services. One is that it would reflect the QIDP professional, that qualified intellectual disabilities professional, also known as the teacher, the special ed teacher, the services that the QIDP is providing, as well as the personal care services by qualified paraprofessionals, so that the the QIDP in terms of the completing the plan, the assessment, and then the plan for the skill-based training programs or IEP goals, and then the ongoing daily provision of those services as being provided by the paraprofessional. Ongoing documentation for PCS services pretty much follows the rule for most other school-based services in that you need to make sure that it's unique to the student, completed on a daily basis. It needs to note the start and end times for the specific Medicaid service, in other words, PCS service or PCS skill-based training, the name and title of the person delivering the service, the place of service if outside of a school, and the student's response to the intervention if appropriate. And again, we've noted that, again, only if the IEP includes a goal for that specific activity or service being provided for the student. So if, again, if you are simply taking the student to the bathroom in that situation, if it's not skill building, you wouldn't need to document the student's response to that service, just that you're documenting all the other aspects of providing the service.
Again, districts have to be familiar with the exclusionary list and be checking both the state and federal exclusion list to be sure that the individuals providing the school-based Medicaid service are not on one of these lists. This should be an ongoing practice that districts take into consideration as far as both for their in-house staff as well as contract staff. Are they on either the state or federal exclusionary list, which would prohibit that district from billing for services provided by that individual? Don't forget that districts must be enrolled as a Medicaid provider to be reimbursed for Medicaid services for students that are eligible to receive school-based Medicaid. Each service is specifically identified on the student's individual education plan or the IEP. The service is medically necessary for the child to benefit from an educational program. Parents and guardians are notified that the school district charter or infant toddler program intends to bill Medicaid for these services. We have a wonderful resource in the Idaho Training Clearinghouse that is going to be the central place for information. This is where the nursing assessment, the nursing allocation tool, the QIDP assessment, and any supporting documents for PCS will be located. There will also be a section for frequently asked questions that allow districts to send in, and we will develop additional trainings based on the types of questions that come in. We will provide written response to those questions, as well as archived webinars and training information. This concludes our webinar, or our section of the module on personal care service, and we're going to open things up for questions.